Okay, I can record this and I'll get it to you for your own little review, and it will be just yours. How's that?
Oh,
All
thank
right.
you.
Yep. If the other girl comes on, we'll give her props to it also. But let's just, where are we? Get there. Sorry. Here's what we want. I have to talk to myself. They say a side of either, um, oh, Diana came back. She didn't get scared of me. Okay. All right. So we'll be going over the theorists, right? This is where you're saying that you are weak, Skylar. Since you're here, I know that Diana would like to go over it too, because I know who she is. So you've got a great exam review. Use it, look at it. It's a lot of information. How do we break it down? So Erikson is a theorist. What does Erikson talk about? He talks about how a person relates to other people around them. Okay, socio, whatever it is, but it's how I respond or how I make people around me respond to me. That's Erikson. So at first, what can a baby do? They can coo and they can cry. What do they need? They need to feed, they need to be changed, they need to be burped or held. When they want that, what do? They say, hey, come get me. And then somebody comes, mom or dad, and guess what? Baby's happy. So now that's the trust. Now, what happens when a baby is not it's mistrusted? Well, that's the baby whose needs that they're calling that other person. They're doing nothing. So now I'm upset. Nobody's coming for me. I'm in mistrust, which means I've cried and cried and cried. Nobody's coming. So a baby who has trust is happy, healthy, a very well contented child because they know if they need something, they're coming. That mistrust could be in a home that's either alcohol or drug abuse or homelessness or some of that, something's going on. And that's where that mistrust could occur. Now, toddlers, my favorite little group. Toddlers are all about themselves. They're all about me, which is, that id type of feeling. Autonomy is automatically me, mine, my, I want it. So, what is the shame and doubt? Well, toddlers are into everything all the time. You've really got to watch these kids closely because they are quick, especially with safety. Now, that shame and doubt is that mom, that grandma saying, hey, watch out. Don't do that. Be careful. Oh, let me help you put the shoe on. Let me. And that child is like, hey, why can't I? Do I have a problem? And they want to autonomously or automatically me, mine, I want to do it. So that is your toddlers. Now, preschooler is a little bit more confusing. It's basically they want to do things and they want to please others, but they don't always do it the right way. So then they feel guilty. Now, school age, very well tested one is here, is school age. What is an industry with school age? Well, think of an industry as a product. It's a factory. It's something you produce, something that you produce well, right? That is what I'm proud of. That's my product and that's my industry. And you get the pride and accomplishment when some people say, hey, I really love you're really good at math, or you play that piano really well, or, oh, I wish I could run as fast as you, right? I feel good. Now, what's the inferiority? It could be that child, hey, why are you so slow? Come on, let's go. We're going to lose the race. Come on. And you can't. That is when you feel inferior because you can't do everything well. So, in a child in Erikson stages, you would never take and give them a chore or a task that they couldn't achieve. As in, you got to give them a little bit of, I got to work a little bit for this, but it can't be so easy to achieve, but it can't be something that will drive them crazy and they can't. So it's that keeping their mind going and feel good, but not making them feel then inferior because they can't finish it. That's the type of things that you will see with your school age. And of course, good old adolescence. These are all about me, mine, who am I, right? So it's who am I, my identity, and who am I going to be in the future? Am I going to be the doctor, the nurse? Am I going to be, a car driver? As my grandson says, he's going to be a YouTube maker, and he's going to have a YouTube channel. I'm like, okay. But again, it's identity. Who am I? That has to do with body image and then confusion. So Erikson, most tested of all of them. That's why I go so deep in it. Freud is all about sex, anything about sex. So it's oral, anal, phallic, genital, and the only crazy one is when you talk about Freud and school age. That's the 6 to 12, 6 to puberty, right? Puberty starts about age 12. So what is a latency? The word makes no sense to me. I can't give you something to relate it to, but it's all about children hanging out with children of the same sex peers. It talks about now you're having good friendships and spending more time and learning more about another person, and that's through same sex peers. Kohlberg. Kohlberg's all about morality. So let's look at three different groups. Infants don't have morality yet. They don't understand right or wrong, not yet. Toddlers still don't understand morality. All they understand is me, mine, I want. They're in that id form of Freud, aren't they? They are the beginning of only understanding I want. And that is in your toddlers. Now, when you get to preschoolers understand right and wrong and the consequence that goes with either a good one or a bad one, right? Now, if it is the preschoolers, the other way to say it is punishment and reward. They understand punishment and they understand when they get their reward. So that is preschoolers. As we get older, and we're talking about school age children love to be accepted. So they always are pleasing. They want to be that good person. They like to please. That's Kohlberg school age. And then adolescents, basically, they conform to the rules that society has given you, as simple as stopping at a red light. I mean, those are sort of rules that society gave you that it could be. Fowler's, I just mentioned it. What I want you to understand about understanding religion and how do we involve our religion or our child or parents' of religion? Well, we don't have to understand somebody else's religion. You need to know who you are. That's all you need to know. But you can let that family integrate religion, if that's so important to them, into the care as long as it doesn't do anything to interfere with medical care. I've done crazy things with that, but it does work. Just know who you are and let them practice what they need to because emotionally they feel better with it. Now, Piaget, oh, so confusing in all these names, right? So, Piaget is all about thinking. So, we didn't learn how to walk before we learned to creep, before we crawl, before we were turning over, before we lifted our head, right? So, we had to learn. At birth, you had to learn how to breathe. Then you put a bottle in my mouth or a breast in my mouth. Now I had to suck, swallow, and breathe. You had to learn it. Then you grabbed a rattle by a reflex. Then you go, ooh, I like that. Then you voluntarily grab it eventually, because now you know you like it. You want to grab it. And then you made a noise with it. Ooh, I like that. So next time you grabbed it and you shaked it and it made a noise. But all of a sudden it fell in your mouth. And oh, I like that a lot better. So as you can see, you can take that object permanent, you know the rattle's coming, and now I'm going to take and I'm going to play with it because I've learned these things, and now I'm going to add even more. As we get older, and if up to that pre-operational, so we get into now taking the rattle, throwing it on the floor because we know mom's going to come pick it up and give it back to us. So again, we've taken from a little reflex grasp and now we're throwing rattles on the floor. So you can see it's the thinking as we get older. when we're now preschoolers, we're learning about using blocks for cars, symbols to play, right? The broom that's, riding around like a horsey, or the arms out and we're riding around in the airplane. That is as we get to that age. Now, Piaget thinking, as we get above preschooler into school age, we start thinking about what have we learned. And what we've learned, this child can do very, very well. That's called concrete operational. That's school age. That means school age children have to see it, touch it, smell it, understand it, has done it before in order to do it again. Concrete, that's school age, right? I've seen it before, I can do it again. Formal operations, you've never seen it. This is a new thing to you, but you had to figure your way out of whatever paper bag, as I call it. And adolescents can do it and they can think. It's more critical, logical thinking. That's your adolescence. Okay. They can, I know I was a single parent with my adolescents, my teenagers, and when they wanted something, they could figure out what I wanted them to do to get what they wanted. And you're like, how did you figure that one out? Because they're always thinking. There's some pictures and some things I put here, but these are all a continuation of what I've just told you about. Play. Play is important. What do we know about play? Well, I want you to know that there's toddler play, preschool play, school age play, and they're different. So we know we can look at play in onlooker, play alone, solitary, and then there's parallel play. Parallel play is toddlers. They have their little pile of toys next to another child with a pile of toys, and all of mine, don't touch mine, playing parallel to each other, not sharing, but we're playing next to each other. That's it. As we get older, preschoolers, they realize put two or more kids together, playing with all the toys is a lot of fun. We don't have to just keep our own, we could share. That's now preschoolers. Cooperative play, same thing, but then they realize, hey, somebody can win. How can we make somebody win? Or let's see, let's build a house from all of these blocks. And the goal would be build a house or a sandcastle or put the train track together, or it could be winning at checkers. And that's the goal. I won something. That's cooperative, that's school age. Cultural differences will always be there. I mean, I came from a very small town in New York country, and it was very non-cultural. And I moved to Miami, Florida, by myself as a young 22 or 3-year-old kid. And I had just finished nursing school. And I was hit with cultures. So I've learned from the ground up that the person to ask about cultures when you don't know is the person themselves. And you will gain more respect by asking them. And remember, you've got adolescents are old enough to ask them. It's not always a parent, okay? Also with culture, being aware that there are cultures that don't eat certain foods. If you were a vegetarian and I didn't realize that, or I didn't ask these questions, and then you get a breakfast tray and there's a big slab of ham on that tray, that would be very upsetting to that child and to that parent. So again, knowing food preferences. Also, there are cultures where men and women, you can't have a male nurse with, their young girl or anybody. Sometimes they don't want only a nurse, a woman nurse. And you'll see things like that. And also be aware, of dignity and covering themselves as we go along. And again, is there any problems if when we're doing these examinations and whatnot, is there anything with their spiritual care that we need to make time for? I mean, some are prayers, some are food, some are things I don't even know. Again, you don't have to understand them. Again, just know you. Now, assessing a child, especially when you're looking at school age children, they're all different ages of child. It depends on, are they 6 years old, 3 years old, or 10 years old? How are you going to tell them? I know if I was going to tell a little 4 or 5 year old little boy, they're going to go get an x-ray. They're imagining radiation coming out the arms and wrists and shooting out of guns and through their chest, and it's going to burn holes. I mean, they could think that way. I know my grandson was thinking that way. So I know many children would. So how would you waylay that stress and that anxiety of thinking of these things are going to happen to them? Well, get on their level, right? First, you have to always get on their developmental level. This child understands cameras and taking pictures, and there's a lot of noise, and there's like what sounds like a machine going on, like a robot. If you've ever been in an X-ray room, as they're moving the machine up and around, click, 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 and it's scary. Warn them that, and tell them you just take a breath, smile, and you don't even feel it, but I'll show you what the pictures look like. It's just like me taking a picture with my phone. And that's all you have to do. I've seen children run down the hall if you don't tell them little examples like that. If you have any sort of concerns about patient safety, child safety, know that sometimes parents give you one story, children give you another. When you're looking at the stories, if they don't match the stories, that injury couldn't have been caused by what you're saying. Again, it's better to be safe than sorry. To protect the child, that's your first thing you need to do. I have protected a few children in my life and some serious things I've seen. So just know it's better to be safe. Another thing with assessments, and now you're assessing a child who's had sexual abuse of some sort. Well, usually there'll be an adult who brings them in there. Remember that adult, we always want to blame everybody of abuse and this and that. It's hard. And I know I've been there. You can't put your feelings upon what's going on. You have to sort of back off and just get the information and try to be that listening ear. Remember, it's not just the child who's a victim here, so is that caregiver. And that caregiver is going through a lot too. Why did I should have, could have, would have. So just always remember them. Another way abuse can be done is something called Munchausen syndrome. Munchausen syndrome is usually a close caregiver, um, any age child, even adults, where the child just continually gets sick and it can't, the thing wounds don't heal. Something is just not right. They're always in the hospital. And you think, why? I don't get this. Well, it could be a Munchausen syndrome. They are trying to keep the kid sick for this attention. So what do we have to do to protect our child? I mean, we can't diagnose Munchausen syndrome, but we can protect the child if you're worried about it, right? So what we'll do is every time that person of suspicion comes in the room, somebody, hospital, has to be in the room with them. They don't have to be in the room all the time, but when anybody that we suspect goes in the room, yes, they have to be sitting in there with them. Also, anything you bring in, make sure you check it. There could be soups, could be creams, lotions, things with stuff in it. I don't know. But again, check it all just to keep your child safe. So let's look about nutrition, nutrition, nutrition. I mean, if you don't put fuel in the tank, you're not going to grow and you're not cognitively going to be where you need to be. So if we don't monitor nutrition and the child's not getting enough, we are going to see things in that child. It's one of the reasons why we do these growth and development, find gross milestones. Why do we have to know those things? Because it actually measures the nutrition we're giving that child, along with height and weight, okay? So we need to know that infants by 6 months double their birth weight. By 1 year, they triple their birth weight. And we're also talking all age children here, from infant to adults. There's a problem with weight or concern about the diet for whatever reason. Know that a diet the 24-hour diet journal. What did you eat yesterday? Just to get a quick look at it. Again, getting that journal, that diary is going to tell you stories, and that's where you're going to start, any age child. Know that when we're looking at these BMIs, no, you don't have to know all the numbers and how to figure these things out. No, but you need to know a BMI of 85% when we figure this out is a risk for overweight. But at 95, we're almost at 100 now, that's obese. And again, if we're looking at that overweight child who's overweight at 85th percentile, let's get that food diary, troubleshoot, see what's going on, and help them. So developmental assessments, we know that's good for so many reasons. We know that states and whatnot have that there for you to help. Let's go into some of these things. Assessing a child. Now, I gave you, and you should have all received some sort of vital signs worksheet on what are normal vital signs from neonate up to adults. And know that they're all different. They're all a little bit different numbers. But the one thing you need to take from it is neonates at birth, heart rate 140 to 160. When they get to be, their respiratory rate is 40 to 60. And even after 1 month of age, that number goes down lower and lower. By 1 year, 100, 120. That's important to know because of medications we give. Is my child in shock? Is the child dehydrated? Do they have a fever? Elevated heart rate? Is it elevated? Is it not? So again, knowing those numbers can help you with those things. Now, one of the things about assessing hearts, it's not to know where it is on their chest. You're going to know that for capstone next term to let you know. So it's a refresh for you. But if you need to get an infant's heart rate, a young child, if they're asleep, listen to their heart and respiratory rate. It's the best time that you can hear their heart and their lung sounds, okay? Or a bigger child who is just sitting there playing content, that's your time too. So take the time when you get it. Know that with children, you're going to hear a lot of this upper airway or bronchial type of breath sounds. If you just listen up into the upper airway above the clavicles, you're going to usually hear on children a bunch of bronchi sounding stuff. And usually that's just their nose. They don't blow it well. So if we get them to blow it well, if we could suction it, we probably would hear a clear breath sound. So know that you need to look at vesicular sounds over the bases to also get, the real breath sounds and not just the upper airway, which is just mucus, which can be cleared. Car seats, important, safety issue. So safety, what do we need to know? Well, children are rear-faced in the rear seat till they're 2 years old or 30 pounds. When they're in that rear-facing rear seat, especially with younger kids, you can use blanket rolls and you can hold them and snug them in. Make sure those harnesses are tightly snug so we really hold that child into where they are. And know that these do expire over time. When they get 2 and over 30, they can be still rear-facing, but front-facing, but in the rear seat. So infant, these are all those little growth and development stuffs. So what is a head lag? A head lag is when you pull a child, a baby, on their back, pull their 2 arms, pull them up, and their head falls back. That's the head lag. Usually, by 2 to 3 months, that head lag should start to disappear. So if you had a head lag on a baby who was 7, 8 months, that's not normal. We know the baby should be put on their back to sleep because we know what? SIDS death. SIDS death are what? From birth to 1 year old, SIDS death. And that's placing the babies on their bellies. You have increased incidence of them going to sleep and not waking up, SIDS death. We know the baby starts rolling about 5, 6 months. This again with safety, worry about child's rolling off of beds, rolling off of changing tables, okay? If they are put those kids on their backs, all of a sudden those little feet come up and they're chewing on their feet and stuff. Absolutely normal. Proximal distal, learning their environment around them. They're going to grasp by themselves. So this is now voluntary, grasping that rattle. Everything in the mouth, because that's Freud, what he says. That's how you soothe yourself. First teeth, first about 6 months, they will be pulling themselves up and creeping. That means like on the side of a couch or coffee table, about 9 months, and sitting unsupported. No anything, no pillows, no stuffy toys, nothing around them. 8 months, they can sit good. And by 12 months, 1 year, they will be attempting or walking. Colic is a pretty rough
Miss
thing.
Bogart, were you going to post this?
Yes, I will. It'll be immediately on my YouTube channel, Professor Bogart, Pediatric Nursing. And you could get that as soon as this is done.
Okay,
That's the
thank
first
you.
place. You're
Okay,
welcome.
thank you.
Okay, you're welcome. So colic is one of those things that, as I said, is very rough, very hard to take care of. And usually it goes away about 3 to 4 months of age. Usually they go and they're crying, and sometimes it's overfeeding, underfeeding, could be not burping right. Again, it's looking at those sort of things. But any young infant who's crying that much, you can't just assume it's a colic. Make sure they go in to be assessed. It could be other things. Intussusception, and week 8, you go into that one. But again, it's sudden abdominal pain, and it constantly goes off, on, and in and out, as I call it, this intussusception. So again, have them checked. So developmental periods in infants. So it's all about just these names. We know that everything is a sequence. We know it's coming first and last. It doesn't mean the sequence in between, it follows the same 2 weeks, 1 week, 2 months. No, but as long as it's moving forward. Developmental pace is basically now explaining that sequence that's not normal if they go on their own developmental pace. And the sensitives are those periods where the child does like big things, like he'll go from standing up to walking. That's a big sensitive period. Fontanelles. Now, why do we need to know when fontanelles close? Why do we need to know they're there? Well, both fontanelles do close eventually. The one in the back of the head, posterior, closes really quick, within, let's say, 2 to 4 months at the max. Usually by 2 months, completely gone. The one up top, that little soft spot that most people know about, should close in the beginning of the first year. If this is still open at 24 months, 2.5 years, it is abnormal and it needs to be looked at. Why? Is it fluid? Is it a tumor? What's going on? Pain in the infant. So we know the infant up to age 3 is a Flack scale. That's faces, legs, activity, crying, consolability, okay? We can also figure out where is this crying coming from by the way that they're maybe banging their head or maybe hands in the mouth. We can sort of say maybe sore throat, or maybe their ear hurts, or they're touching their tummy, or their legs keep going. That's how you figure out the location. So the good thing about infants, sometimes you just give them a little bit of acetaminophen, which you think is nothing, but they've never had pain medicine, so it works really, really well. Also, sometimes repositioning. And then the biggest pain reliever for young children is that pacifier. Let's say they're having a procedure and they're just, let's say a young infant needs an IV put in or labs drawn. Give that infant a pacifier with sucrose, sugar water, and that actually works like morphine. And it works that well. There's been a big study by Harvard that came out. Also, breastfeeding. I've actually had quite a few mothers breastfeed while I'm trying to put an IV in or whatnot. And it's what they wanted to do. So I worked around them. So SIDS death, as I said, it's birth to 1 year old. How does it happen? Is when you put them on their side or on their tummies for nap time or bedtime. Any loose bumpers and things in there, blankets, bed sharing, mom and dad, right? No, shouldn't be done. Um, Having that baby too overdressed, so they're overheating them. Cigarette smoke is one of the number ones for prevention of otitis media, and it's also prevention of SIDS death. We know that prenatal care is good. And if they've had a recent viral illness, because remember, that's usually nasal mucus. And infants, that first year of life, they're obligatory nose breathers. So their nose is stopped up. So it's going to be hard to suck, swallow, and breathe. So that's what that happens. Premature babies, male babies. And actually, there's higher incidence of formula-fed babies. You're at a better chance if you breastfed. So some of the reflexes, infants, there's the moro or startle. That's that top left one. It's make a loud noise or hit a crib. Their arms and their feet come up, and it's quite distinctive, okay? That one that you take and you crawl the side of their little cheek here, and that is to go feed. You stroke the cheek and they're looking for that bottle or that nipple. Those are the two big ones that we look at. Parachute is take a child who's now about 6 months old, turn them on their tummies to put them down, and their hands and feet will come out. It's a protective thing. Think about you go to fall, what do? Hands come up. This goes on for life now, okay? You don't see this with children with cerebral palsy. That's why they're more of a fall risk. Nutrition the first 6 months, breast milk or a iron fortified formula. After that, remember with breastfeeding, you should be getting some vitamin D with that. And know that breastfed mothers, if the baby is having 6 to 8 wet diapers, we know that they're getting enough to drink. Also, are they gaining weight? So they're doing okay if they're gaining weight too. The second 6 months, we're going to introduce one food at a time every 4 to 7 days before adding another food on. And you'll be checking for allergies. Know that the problem with adding food, and actually continues on for life actually, is not all food is digested in the GI system. So know that you might see some food in their stools after you start feeding them food. Very normal. It's not a problem. At 12 months, you can add whole milk, and you shouldn't add honey till after 12 months old. And they're also saying for that dairy alternative for some of those, maybe it's lactose intolerance, they can start adding some soy-based yogurt, and they do that at 6 months also. So vaccinations, there's a lot of them. And I know you're like, oh, what do I need to know? Well, hepatitis B is the first one we give, usually in the hospital. We know that we start giving these big, large amounts, the DTaP and Haemophilus and the pneumococcal. We start those at 2 months, 4 months, and 6 months. Now, what are some of the complaints? Well, parents say that it's going to hurt. It's too much. Well, we can give a good topical anesthesia there to try to numb the area so it doesn't hurt as much, can't we? Know that children after DTaP, they can start running fevers. That's where their leg gets a little bit red, and then that child can run these low-grade fevers. Absolutely normal up to 2 days after getting that immunization. The flu shot, influenza, is not given till after 6 months. And then know where do you give an injection on infant, and that's the vastus lateralis. I put the chart there, it's from your book. Toddlers in pain. So toddlers, what age are they?
Is the cream that numbs, is that the Emla cream? Is that, am I pronouncing that?
Yeah, Emma's one of them. There's also Let. There's spray stuff. There's quite a few of them, but Emma, yeah, that's one of the ones you can use. Absolutely. Same thing you would use for a spinal tap. We use those to numb the area really good. Adults or children, we do use that. So toddlers in pain, their ages 1 to 3. What scale are we going to use? Flax scale, right? Infants up through toddlers. Again, we're talking, one of the things is head circumference and their chest. It's only because they relate growth. How's the head relating to the chest? At birth, that head was big. Now, by 1 year old, the chest should be as equal to, or it should be bigger than the head. That's because the head has to come out at birth and it has to make room for the chest. Nutrition on toddlers. Remember, these kids are becoming finicky eaters. These kids, you worry about them becoming physiologic anorexic. With these children, hemoglobin hematocrits are going to go low. We know that. So we need to start offering things like whole milk at 12 months, and we're not going to hold the fat. Even if the kid's overweight, because they need it for their brain, their central nervous system. And that whole milk does give you a lot of things that they do need, okay? You know, toddlers, as we know, they are finicky eaters, and we can use sometimes food as a reward, as in, okay, if you finish your meal, okay, you can have your apple juice. Maybe that apple juice is a reward. I knew some of my grandchildren, that would be the reward after they ate. Know that when you're feeding the children too and talking about nutrition, know that things like vegetables, you know, if they're fried or are they roasted? I mean, you're going to get better vitamins out of the roasted. So you would definitely roast your vegetables. Another thing is, let's say your child is getting iron deficient because of the diet they're eating. It's the macaroni and cheese and chicken nuggets and apple juice is what they like. Somehow we got to get meats, eggs, green vegetables. Those are great sources of iron. Remember, protein we need for wound healing. If they've had something with a wound, we need to get protein into them. You know, toddlers are the scariest of all the children because they don't like you at all. Remember, they still have that stranger danger into them. So, first of all, you get down below their level. You know, we're doing nothing at first. It's, you know, looking the situation. Then we're going to try to get that child be able to open up to us. It could be as simple as saying, oh, you got a Spider-Man t-shirt on. I love him. Where does he shoot his webs from? Now I'm not threatening. As simple as that, these children tend to calm down on you. Know that you always go from least to most intrusive, okay? If they want the mother to hold them, by all means, it's the program I developed. Help us give great injections efficiently and safely. And that's by holding your child for anything. Like mine was for injections, but it could be any procedure. It does decrease that sort of stress. Also, use play. So is my heart up here? Can I listen to it? You know, make fun of things. No, they know where their heart is. That's the one thing they know, or where their nose is, and put the nose at the end of your finger. I mean, do crazy things. They'll giggle, and it will be so much better. Now, when a toddler doesn't feel good, it's in pain, you are going to know. Usually, they're not playing, they're not eating, not drinking, and don't want their favorite anythings. And they're crying and nothing's helping them. You know something's going on. So, flax scale, as I said, remember, it's not just about giving drugs, medicine. I mean, acetaminophen is a drug, and that's usually the first, or ibuprofen. But know that things like distraction, music. I had stickers in my pockets walking around in ER, sometimes in traumas. That kid made a kid smile. That's all that matters. Distract them. Remember, just elevating ahead of a bed when their tummy hurts. I mean, as simple as that. Music, I used to play all night long. I was a night nurse, and the NICU and the cardiac ICU, they all slept all night long because music was on. And the parents continued playing music when they went home because it works. I remember older children, they're going to say a hot pack, a cold pack, and again, distract them with something. Another thing is we're looking at pain, okay? A lot of children, especially younger ones, don't want medicine because of two things. Number one, it don't taste good, or it's because it's on the end of a needle and they don't want the shot, right? So if there is intranasal, is even better than giving it IM sub-Q, right? So that's a better thing, intranasal IV. And then if we can, orally. They don't sometimes like the flavor, but again, it's better than a shot. So if we can show them, we can give a medicine, and then we can numb that pain for the pain medicine if we need to. You know, we don't want the child to be in pain because they're not asking. Toddlers, as I said, grow slower. Slow, steady, they don't need much. As I said, they're physiologic anorexic. They're picky, picky, picky. And one of the things they say is do not give them juice or snacks before meal times. Their gross motor skills are getting better and better and better, right? They're using both hands throwing a ball by about 18 months. Remember the play toddlers, parallel play. They are now by 1 year old, of course, it's mama or dada. By 2 years old, it's two multi-word sentences. So mama and daddy, I want milk. I mean, we're getting more and more and more. We're starting to try to do everything. And we want to do everything. Me, mine. We're doing potty training. No, bowel training comes before bladder. Potty training, why do we need to get there? Most of it is because we can hold the urine now. And we also know that mom and dad are going, yay, when you're done doing that first in the pee in the potty, right? Now, toddlers, injury prevention, this is huge. These kids are, as Seinfeld says, having a 2-year-old is like having a blender without a lid. Turn it on. They are everywhere all the time, all at once, and you can't keep up with them. So you really, really need to try to keep them safe. We know they have temper tantrums, normal. Timeouts, the best form of discipline, toddlers. That means 1 minute per age of life. And then because they're into everything all the time, if they're put something in their mouth, it could have been a medicine that fell on the floor. I've seen rat poison. I've seen all crazy things toddler put in their mouth. So poison control. You do the poison control number before anything. Parents should not get the keys and run out the door. They need to call poison control first. They may need to give them a cracker or a milk. Usually, they'll never tell you to revomit what you have in your mouth, but there might be something to slow it down by the time you get there. And what's great, poison control will follow up at the hospitals. Toddlers need routine. Remember that. Especially bath time. They know night or day when they're going to get their bath, get their jammies on, get ready for bed. That's usually, but some will get in the bath, get their clothes on, get ready for the day. You have to figure that out. The biggest autistic group that will be affected if we do not do routine is your autistic cognitively delayed children. Now, preschoolers 3 to 6 are now faces, scale, and pain, right? They're all about, they get cut, they're going to be blooding, and they're going to bleed out everywhere. So put a Band-Aid on it and it fixes it. What do preschoolers know about right and wrong? Remember, at preschoolers, they understand reward and punishment, okay? They also feel that if they fell down and got a boo-boo, it's because they hit their sister yesterday and God is punishing them. It's part of their belief. Preschoolers, same thing as toddlers, slowing down, still picky, but they can tolerate change a lot more better here. Preschoolers are using the FACES scale from ages 3 until you're adult you can use, but it starts at age 3. Gross motor skills, 3-year-old can walk a line. By 4 to 5, we're jumping now. Know that one of the problems preschooler and to be aware of safety is motor vehicle injuries increase in preschoolers. It's because they're running out, they're more confident, they get up and they go, turn your back, they're behind cars and parking lots and driveways. So you have to really be careful. And of course, always using safety equipment. By age 6, children should be able to ride a bike, jump a rope, and play hopscotch. Fine motor skills, we can thread things, we can draw on the lines, right? We can color, we're doing all sorts of stuff. Chickenpox is airborne. Communicable disease, absolutely. Even with the varicella vaccine, you still can get chickenpox. So if you're confronted with it, always remember, help yourself, N95 mask, and get that child into a negative pressure room, which means the air in that room isn't going to go back in a hospital where other children who are immunosuppressed can get ill from. So get that mask on them, put them into this room. Now, chickenpox, it's hard to tell when they're communicable because it's after they erupt in their rash that they are communicable. So they are communicable until all the lesions are dried up and crusted over. There's been no fever in 24 hours. They can go back to school. Types of neglectors, all types. We've talked about this a little bit already. Just know we're concerned about injuries that don't match, right? About the injury and what the history of what they tell you happened it. Also know that parents are suffering. Preschooler, these are numbers, 12 to 1400 calories they need to have a day. Protein, we need that 13 to 19 grams a day, and that's for muscle growth and good wound healing. You would be concerned on that if you had a child who had a big open sore that wasn't healing, that you were at the hospital knew were dealing with and treating, etc. Strong bones and teeth. You've had a bone, break. You can make sure they're going to have that 700 to 1,000 milligrams. Again, nutrition, you can find out again what they ate yesterday. It's not a big deal. Again, mentioning it, you can always infuse the lax, like if you're iron deficient, we can put, again, green leafy vegetables will always be iron deficient. And of course, eggs and meat. School age. School age children starts from their baby teeth. Now we start getting all of our permanent teeth, and they're all in by the time we turn 12. Its growth is slow and it's steady. So awareness now is becoming more and more. Piaget talks about, if I had 2 8-ounce glasses, one was tall and skinny, one was short and fat, both had the same looking amount liquid in there, a younger child would pick the tall, thin glass, that it was more fluid because it looks bigger. School age would know there's still an 8-ounce glass. They still would understand that. Erikson, as I said, it's same-sex peers. And school age, again, Kohlberg, love to please, love to please. Injury prevention, always biggest, any group, children is always motor vehicle. That will always be number one. Know that a lot of times children who have stressful home environments are going to have an increased risk of injuries. They're just so upset with the stress that they tend to do things they may normally not have done because they're, quote, not thinking correctly. So again, if you start seeing something happening, a kid's having injuries, it might be looking at what's going on at home. They should be in the rear seat till they're 13 years old. I had my kids up there younger than that when they were that age. As a bad mother. We should always use things like helmets. Always remember, all sorts of safety equipment for everything. And ATV children, they must be 16 and older. Younger than that, they cannot fight them way out if they're having issues. We talked about communication. Let's talk about ADHD in school-age children. This is quite a bit. And I know that I even had a best friend whose son was labeled with ADHD. And they said that the kid was spoiled and didn't listen. And it was because mom and dad did nothing at home. And the thing with that is they did everything they could possibly do. She's a nurse like me. And this child, they went through everything. One of the things about ADHD is that inattentive hyperactivity. They can't finish a task, okay? And then you send these children to school nurses, and the school nurse makes a plan with a parent. The thing the school nurse has to realize, some of these parents have been through the ringer already. They need to listen to what they've already tried and then make a plan. Children, as they get late school age into adolescence, they can be depressed for many things. Know that any changes in behaviors, sleep patterns, eating, etc., should be taken seriously. Dental health. Children at our school age are going to lose all their baby teeth. So it's not that they're losing teeth because their teeth are rotten, but they can get cavities which do hurt, okay? Also, they should be flossing. It's the single most important thing. And we know it takes till about age 6 to be able to do it properly. I already talked about chickenpox, Reye syndrome. Aspirin should not be given to any child for a fever or any other reason, except for the reason you hear in week 5. And that's a disease called Kawasaki. Reye syndrome, if you've had a viral disease like influenza, and you take and give aspirin to it, there's some metabolic thing that happens and they get something called Reye syndrome. And it's extremely serious and it's very hard to take care of. So we try to prevent it all possible. So they say chickenpox or flu-like, any virus. Adolescents, how do you talk to them about their sexual history? Get them in a room alone, right? And try to get on their level, that developmental stages that we have to do for them. Know that teenage girls come into you and they want to talk about sex and contraception and protection, etc. And can we talk to that 16-year-old girl without a mother? And the answer is yes, we can. We can even ask parents that are in the room to leave to talk to that child alone. And we don't have to tell the parents what we told the child, but all we can give that child is oral and written information, not our opinion, okay? But we can give them information, okay? STDs in adolescents, we know there's a 3-series vaccine that we do give. We know children with that sense of identity. We've gone over this already. Again, it's all of that, all of the other adolescents and, trying to tell them what to do. No, firearms is a big one also with motor vehicles and injuries. And nutrition. Children should be getting proper nutrition by their adolescence. They should know, right? But again, they grab a power bar, they get a bottle of water, they go for the day and they don't eat, and they're not getting all the vitamins they should. So we're going to be seeing some issues somehow, some way. So again, how do you figure out nutrition and behaviors? Get a 24-hour diary of it all. Adolescents don't sleep as much as they should because they're busy getting ready for the morning exam or getting that project done, or they're up, oh, they got a brand new boyfriend and they're texting till 5 in the morning. We've talked depression, suicide. Now here we are, it's our last slide. It's talking about Tanners. Tanners is a slide that goes and it looks at puberty and menstruation and the changes in males and females. Menstruation will start 2 years after the beginning of puberty. Beginning of puberty for a girl, you're going to start seeing breast buds. In boys, you're going to start seeing an enlarged scrotum. So 2 years after that, they're going to start menstruation. Know that girls, because at the beginning of adolescence, there's a pre-adolescent growth spurt. So they're eating a lot, right? Their body's changing a lot. This is the second time in their life that they do this much growth. And they'll do this much growth in a shorter period of time. It is not uncommon at all to have fast increase in height and weight. And these young adolescents with all these irregular menstrual cycles can be very, very moody. So just be aware of that. Dosage calculation, if you need help, I can give you more than that, whatever you need. And I appreciate your patience. Anything I can do for you?